Hi Betsy, hi Donna.
Hi.
Hi.
How are you ladies?
Great.
I'd like to start off by saying thank you for taking out the time to educate our audience today. I know we're going to be talking about some of skin cancer types, and now that it's the summer season, some safety tips that we can give to moms and summer camp coaches and all of this stuff to educate and make sure that children and families are safe this summer. So we're going to start off with some few questions. Betsy, if you want to introduce yourself and explain what you do, as well as Donna.
Sure. So I'm Betsy Peppel. I am the coordinator of community outreach education for Harrington. So if you see that big 42-foot mobile van, I'm usually in there taking blood pressures. But today we're going to be talking about skin cancer and how to prevent it.
And I'm Donna Kentley. I'm a physician assistant here at the Cancer Center at Harrington Hospital. I will be talking about the different types of skin cancers and how to identify them.
And Donna, what are the most common skin cancers?
The most common is actually the squamous cell.
Okay, and what is that? If you could just explain a little bit more as to
what it looks like, or
yeah.
Okay. Do we have? We don't have a picture. Yeah. Basically, any abnormal mole is what needs to be evaluated. You know, the different ones different moles can be presented in different ways, and the squamous cell, I believe, usually is more of a abnormal shaped, flaking, bleeding is one of the big signs, and redness around the lesion, and those definitely need to be evaluated by your doctor.
And what are the warning signs of skin cancer?
Use this one?
Yeah. So for melanoma, we look at the ABCDEs, and A is for asymmetry. So if you're to look at a mole and cut it in half, is it the same on both sides? B is borders. Generally, a mole, a normal or a benign, non-cancerous mole, is going to be pretty regular in shape. An abnormal mole like this one here with irregular borders, that should prompt anybody to have that looked at. Color. The color should be consistent throughout in a normal mole. Abnormal moles will have different colors. Melanoma will tend to have a really dark or black portion of it. D is diameter. About anything larger than 6 millimeters, which is going to be about the width of your fingernail, your pinky, also should be evaluated. And yeah, pencil eraser, yeah. And E is evolution. So that's the newest one that we're also trying to encourage people to be aware of, and that is the mole changing? And in my years of practice, anytime a patient says, well, the mole is changing, that immediately prompts me to want to take a biopsy and make sure that we're dealing with, or at least getting rid of it.
Okay. Now, do you find skin cancer becoming more common, and what are some of the risk factors?
1 in 5 people.
Yes.
1 in 5 people over their lifetime will be developing skin cancer.
Yeah. And of any different type of skin cancer, not just melanoma. And the biggest prevention, and Betsy will talk about this in more depth, is sunscreen, and 24/7, 365 days a year, because even if it's on a cloudy day, you still are getting UV exposure.
Okay. Now, Betsy, I see this white box next to you, in front of you. Can you kind of explain what that is and kind of tell us what you do with it and give us a demonstration possibly?
Sure. So this is our sun damage screening machine. So it's not going to tell you if you have skin cancer, but it's going to show sun damage. And sun damage presents itself as freckles and brown marks. And so I'm going to have Donna as the person to try it. So when we're out and doing outreach, I usually have the person put on either moisturizer with an SPF that has certain key ingredients, which I'll tell you about in a sec, or the sun lotion. So she's going to put a little bit on her fingertip, a little on her nose, and a little bit on her cheek, and she's going to look in here, and she's going to go, oh my gosh, because what she's going to see is purple, the spots where she's put the sun lotion, because that shows a protective barrier from the harmful UVA and UVB rays. So UVA rays, they cause wrinkles, and the UVB causes burns. So let's have you put a little in your finger. And I know she has a sunblock on her already, because she said that she puts this really great moisturizer on every morning. And so she should already have like a purple glow, but by putting this fresh layer, she's really going to see the protective barrier. So there's a mirror. Look way in and see the mirror.
Oh my gosh, yeah.
Do you hear her? She's saying, oh my gosh.
What a difference.
Yeah.
Yeah.
So she's got a light purple from the moisturizer that she has on already, but now what she's put on is a darker purple right here.
Yeah, so you can definitely tell the difference, and I can also see all the freckles.
Yeah, yeah. So freckles are sun damage, and if you're my age or a little older, we didn't have this nice SPF protection. So
No, it just really wasn't anything that was pushed, as a child, just went out in the sun. And I remember my brothers who were blonde hair, blue eyes, and they would wear t-shirt and hat because they'd get blistered. I never did, but I don't remember sunscreen being something that was readily available, or
it wasn't. But you guys have no excuses anymore, because look at everything you can use.
So Betsy, tell us, what can we do to protect ourselves from the sun?
All right. First thing is, as Donna said, make sure you put sunscreen on every day, 365 days a year. So not necessarily sunscreen itself, but you can get a moisturizer. Everybody, men and women, should be putting on a moisturizer that has an SPF of 15 or higher. And there's certain key ingredients that you should look for. So first of all, it should be, for sun lotion especially, broad spectrum. But then it should have either avobenzone, which is also called Parcel 1789, or titanium dioxide, or zinc. So remember the lifeguards used to put the zinc on their nose as the white stuff. Well, it's clear now. So the avobenzone is more of a chemical protector, but the titanium and the zinc, those are really good, because that's a physical barrier.
Mm-hmm.
And Donna's moisturizer has actually the titanium dioxide.
right, and it's tinted. So basically, this is what I use for foundation, and I get my sunscreen, and I get enough, coverage, and I don't feel like I don't have to put anything else on.
Great. So Donna, there are makeup products out there in the market where you can
Absolutely,
purchase
yeah.
that do protect you from the sun.
And this is Lancome, so it's going to be a little bit more expensive, but there's other, Revlon, I believe, has some, and Max Factor, that you can go to CVS and get tinted sunscreen.
Great.
And they're great products as well.
Perfect.
Yeah.
Awesome.
Right, so you want to look at the active ingredient. So that's the key ingredient or active ingredient.
Should be the first one.
Yeah. And also for protection, so you need to make sure you have enough. So a lot of times people say, I burned, but I had sun lotion on. They probably didn't put enough on, and they probably didn't reapply it. So I have my great visual. So you need at least a teaspoonful for your face, okay? We're not drinking on the show. This is a shot glass, because you should have at least a shot glass full of sun lotion for your body. And we also recommend that before you go out in the sun, so this is when you're heading out like to the beach or the pool, it's not like every day, but unless you go to the beach every day.
I wish.
Be nice, I know. So look in the mirror without your clothes on, get your coverage everywhere. Then you would put your bathing suit on.
Mm-hmm.
And then sometimes people say, well, is a spray okay? Well, that's okay, but first do the lotion, okay? That's my recommendation. So always lotion up, and at least 30 minutes prior to going outside, because you need to get it to absorb into your skin. So if I'm out there exercising and I'm all sweaty, I should be reapplying. If I've gone into the water, come out, reapply. Okay, really
And
important.
at least every 2 hours.
At least every 2 hours, yeah.
And it's also, like Betsy said, looking at the different areas, because these are the areas that tend to get missed. The back of the neck, the ears. How many times have you gotten ear, and you're peeling because you forgot to put it there.
Top of your feet, back of your hands.
Yep. Underneath, these are all places, especially if you're active outside, you're not going to realize that these areas hadn't been covered until later when you have a sunburn.
wear a nice
hat.
waterproof hat. It's Donna's. I love it.
That's my gardening hat.
So wear it when you're gardening. Wear it, when you're out boating. Wear it
Yeah.
when you're walking the beach. Or if you don't want a full hat, at least a visor, to cover at least a part of your face. But the wide brim hat is best because you can get melanoma in your hair.
Oh yeah, the scalp. I've seen patients with burns going down their part because they didn't put sunscreen there. Because you don't think about it.
Exactly. So
Yeah.
that's where the spray is really important. So if you do have parts, spray in the parts of the hair.
Yes.
This is making me think. So when we go to the doctor for our annual physical, they should be doing a full body scan for skin cancer, for those A, B, C, Ds that Donna was just talking about. They should be looking in your hair. They should be looking behind your ears. They should be looking all over between your toes. Melanoma can be on people's feet. Yeah.
And Donna, as a physician assistant, what are some treatment options out there for cancer patients with skin cancer?
Well, it depends on what it is. Like basal cell, any of the cancerous ones like basal cell, squamous cell, melanoma definitely need to be excised and completely excised. Actinic keratoses, which is kind of a red raised lesion, not very big, a few millimeter or maybe half a centimeter, and will be kind of flaking, those. And seborrheic keratoses, that's from sun damage over the years as well, and it has like a waxy appearance, and the wax usually over time falls off. That's the thing that you see as we get older, they can be all over like the chest, especially the back. And those are not cancerous, they're more nuisance, but those are from sun damage. And those can be treated with just liquid nitrogen at your primary care office, same with the actinic keratoses. But the others definitely need to be excised and should be done, seen by a dermatologist.
Okay, and Donna, you want to share your story with us?
Yes, I had melanoma, and like I was saying earlier, my brothers who are blonde hair and blue eyes, they burned in the sun. I usually tanned and I had a couple of sunburns that I can remember, but about 10 years ago, I noticed one mole on my thigh. And I thought, well, maybe I'll just watch it. But then I had gone to a board review course, and they started talking about the common melanoma in women and on the thigh and the calf. And I immediately made an appointment with my primary care doc, who then, and it was for an excision. I had asked for an excision, and she looked at it. She's like, "Oh, I don't think it's that bad." And I said, "But yeah, we're going to remove it anyway." And sure enough, 3 weeks later, on a Sunday morning, I get a phone call that it was in fact melanoma. And so I had to go back in and have a wide excision and sentinel lymph nodes removed, and everything came back clean, which was great. But I felt that I was a good advocate for myself because I knew. And one message I'd like to get out there is that if you feel that it just a mole just doesn't look right, make sure that you're insisting that it be removed. Because you just never know, and the best thing to do is have it looked at and have it removed and be done with it.
Great. And so, to just pretty much going off of what you just said, where do patients, or what is the first step as to whether getting into skin cancer screening, or if they are concerned, what is the first step into making to get evaluated and get checked?
Primary care, their primary care doctor, and if they feel that it's more complicated than the initial presentation, they can always refer to dermatology. If you have a family history of skin cancer, you absolutely need to be seeing dermatology at least once a year. All my siblings now go to dermatology once a year for their skin checks. And,
Great.
Yeah.
Great. Betsy, is there anything else you'd like to add?
Yes, I do want to add to this because I've had basal cell. So basal cell, I like to think of skin cancer because it's the basal cell, which is like the basic skin cancer, then the squamous cell, and then the melanoma. So I had a basal cell, and that was most likely from a really, really bad burn I had as a kid. I fell asleep on a dock, I woke up, and my back was all blistered. So if you've had a really bad burn, then you're more likely to have skin cancer from that spot.
Great, great. Well, thank you, ladies, very much for informing not only myself, but our audience. And have a wonderful day. Thank you, guys.
Thanks for having us.